today, Board of Health. And I just have to say something. Oh, that's usually. Yeah. And I went to the store. It was Wednesday,
Hi, good evening. This is a regular meeting of the Board of Health of the Borough of Victor Lawrence held on January 21st, 2020. I call this meeting to order and declare a quorum present. Would everybody please rise to the pledge of allegiance to the flag of our country. Please remain standing for a moment of silence for our military. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. May be seated. This meeting has been advertised in one newspaper, the Daily Record, in compliance with the New Jersey Open Public Meetings Act. Attendance?
Vera Cheatham. Here. James Glass.
Here.
Kendall Hitchcock. Donna White. David Holman.
Here.
Ismael Lorenzo.
Present.
Andrea Garcia Montes.
Motion to accept the minutes of January 1st. Oh, excuse me, January 15th, 2019.
Motion to accept the minutes of January 15th, 2019.
Second.
All in favor? Secretary will read correspondence as received. There is none. There is none. Okay, new business. Appointment as Secretary for the Board of Health, 2020. We need a motion.
Who was in that? That motion to include Kendall.
Second.
All in favor? The roll call. All in favor? Aye. Okay, Kendall it is. Okay, report from Rockaway Township.
Chair, Mayor, this is
Happy New Year to you,
And
Pete.
Happy New Year to all of you as well. Happy New Year to members of the public. Briefly summarize, in the fourth quarter of 2019, we had one retail food establishment inspection and then one follow-up at that establishment. We had a plan review for retail food establishment. Formally one complaint investigation, but you notice on the third page of the report, second page of the narrative, that there were a couple of other issues that were looked into, minor issues. One dog that had a case of kennel cough, which was quarantined and returned to the owner from the Pack Mentality facility, and per Title 8 of the State Administrative Code, the attending veterinarian has to oversee that particular animal, and that was done so and confirmed by James Brighton of our department. We also had one heating complaint, which was referred to the owner, and the plumber was scheduled. Mr. Brighton did try to reach the complainant and a couple of times afterward and did not receive a response. I'm assuming if it continued to be an issue, that the complainant would have used James' card to be back in touch with us. We had a couple of educational interventions, just speaking with residents over the course of time regarding those complaints. 15 flu vaccinations for residents. We don't limit the number of people, and we hold that clinic right here, so that was a fairly typical number this year. Also working with our nurses, and we had a nurse whom you may have met over the last several years, Susan Suey. She was our nurse supervisor. She retired early in the quarter, and we hired a full-time nurse named Angela Skokandish, who lives in Rockaway Township, who's been working out fantastic. She's terrific, and she's been here. She was here for the flu clinic assisting Janet Hess. And we also hired another part-time nurse building on our staff, named Amanda Vendette. She largely performs services in the town of Boonton, but she's with us in Rockaway Township as needed, a minimum of 1 day a week. So she's available to be of assistance with communicable disease follow-up, checking lead tracks for ongoing lead cases, immunization records, etc. Here in the next quarterly meeting, if it pleases the board. She's very sweet, and she and Angela are both great additions to the department. So. Janet Hess, our longtime nurse, has been a great mentor to both of them. They both have several years of experience, but largely in emergency departments and hospital environments. But they picked up really quickly, a great learning curve, so they're already in the full swing for several months now. To date, for the year end, we had 16 communicable disease reports, many of which were not actually cases but had to be fully investigated by our nurses. Several training opportunities that they availed themselves of, and later in the report there's a longer list of professional meetings and trainings that all of our staff, including our health educator, we also hired another part-time inspector to add to our staff. So we've just augmented our professional staff, obviously at no cost to Victory Gardens, but we're even better staffed now just to get out and do the work quickly and efficiently. And,
You mean no additional cost?
no additional, yes, I apologize, no additional cost. Good clarification. But Nancy Immediato is the name of our new part-time inspector. She's been with us since a little before the holidays. She has about 20 years experience, all with Wayne Township, and I've known her for most of those years through professional circles, and she's terrific. So she may be in Victory Gardens once in a while, just as part of our inspection staff.
Can you bring her back?
Do you want
Can you
me-
bring her?
Miss Immediato?
Yeah.
Oh, sure.
Both of them, actually.
Yeah.
Anyone that you have?
Yeah.
Just meet them personally.
Absolutely. I
Yeah.
love bringing them
Yeah.
to meet with board. Yes, so I could bring Amanda, Angela, and Nancy.
Right.
Yeah.
Next meeting, absolutely.
Yeah.
And I have a couple of items I just wanted to mention in the health officer items for discussion, and then a couple of additional items that are, a couple of which are in your packet, and a couple of which I just added this afternoon. First is just to mention that we're going to be compiling our annual report for the state. The state has, it may not be of specific concern to the board, but the state has a rather extensive local health evaluation report. And so we compile the data from Rockaway, from Boonton, from Victory Gardens, and the state has reduced the number of categories, so it should be a little less of a pain this year. I started putting together a different kind of report, a narrative report, that the public could consume, that would be user-friendly for the public, governing bodies, other interested parties, just describing what it is our staff does, in what kind of venues, the sheer numbers, both budgetary and field work. Again, just so it's a thing that can be posted online or made available in facilities like this, so if the public wants to know what their health department is doing, the scope of services, it'll be readily available. The state requires us to give them a bunch of numbers, and they never really regurgitate the numbers and tell us, you know, what the baseline is or what the numbers mean. They just, they like their data. But I want to produce something that has a nice read to it that describes what exactly it is we all do. So I'll look forward to getting that to you in the next few months. The state annual report's due late February, so as soon as that's submitted, I'll be able to convert it to a more user-friendly report. You all may be aware of the recent activities in Trenton as recently as last week with regard to, I think it's Senate Bill 2136 was the number. This was to eliminate religious exemptions to vaccination in public schools. The bill originally was designed to eliminate all religious exemptions to vaccination to boost what we call herd immunity, to boost the vaccination rates, to better protect children from communicable disease. There was a modification to it, I guess you could say a bit of a compromise for the people who wanted to see it pass in the state legislature. Senator O'Scanlan, Declan O'Scanlan from Monmouth County, who's a friend to the State Health Officers Association, modified it and agreed to support it if the private schools and child care centers could have the option of not enforcing the religious exemption. It lost by, I think, 1 vote in the Senate several days ago. So Senator Sweeney has committed himself to seeing it go to the legislature again for vote at the next session, so we'll see what happens. It probably wouldn't have dramatic effects on Victory Gardens, for example, because of not having the number of schools and those facilities that some other communities do, especially our larger cities. But it's certainly a hot potato political issue. Yeah, and so several thousand people showed up in Trenton to protest the legislative bill when it was going to be presented. And it had already passed the Assembly at the state, but the Senate, again, just by a narrow margin, did not vote for it. It's, public health officials, and I have a couple of position papers, one of which I wrote a letter to the editor last week at the request of Senator O'Scanlan. I wrote it with the current president of the State Health Officer Association. I served in that role 12 years ago and remain active. And the letter was published by NJ.com and I think a couple of our papers in the state. But the consensus of state health officials is of course, we support whatever's going to boost vaccination rates and keep kids healthy, and free of the risk of disease, or at least more free of the risk. So I think I provided a copy of the letter to the editor that we wrote. It's just a one-page document that should be in your packet. And again, that reflects the health officials that work for our communities across the state. I also provided in your packet a copy of the New Jersey Local Boards of Health Association fall newsletter, if it's of interest to you, and also a copy of the state's New Jersey Communicable newsletter. It's from their Communicable Disease Service, which just summarizes some of their activities over the last half of the year and some of items of information that might be of interest to local boards of health and, of course, health departments. I don't know that I left a copy in your packets of Senate Bill 3265, but this was just signed by the governor literally in the last couple of days with the end of the last session. This is now law, and it prohibits the sale or distribution of flavored electronic smoking devices and the related products that come with them, like cartridges, etc. So it's designed to prevent or preclude most kids from the attraction of banana-flavored vaping, cigarettes, and things like that. What they define in the bill as products that have a characterizing flavor. So including but not limited to fruit, chocolate, vanilla, honey, candy, cocoa, dessert, alcoholic beverage, herb or spice flavoring type flavors and scents. So the data nationwide just shows that these products are being targeted to kids, and clearly it's getting in the hands of junior high school and high school students
You can't participate in the
So
first time.
that's the objective of this particular Senate bill, and like I said, it's now law. So the enforcement, it'll be converted to an administrative code, so we'll find out who the enforcing agents are. My understanding is local health departments, it will be among those enforcing agents. And the fines are identical to those that were first imposed and remain for the Smoke-Free Air Act, which keeps people from smoking in public buildings. So $250 for a first offense, $500 for a second offense, and $1,000 for a third offense. But that's in summary the bill. If it's not in your packet, I can certainly provide a
Yes.
copy. Okay, very good. There's something else I don't recall if I put in your packet. I believe I did. This is the Public Health Association's collaborative effort. It's a two-sided, two-page position paper on the importance of vaccination in New Jersey. This particular organization is composed of the 5 recognized professional public health associations in New Jersey, which includes the Health Officers Association, the Association of Public Health Nurse Administrators, the Society for Public Health Educators, the Environmental Health Association, etc., and New Jersey Public Health Association. So just, again, another consensus position paper about how health officials feel about supported. And that's, I believe that represents all the items that are in your packet. Just one or two other things I wanted to mention among items of discussion. I'm not sure if anybody has heard today or yesterday about the coronavirus
Yeah.
and about some concerns. We had our first case today in the United States in Washington State. As of this morning, or 2:30 this afternoon, I read a CDC report. To date, there are 40 known cases, mostly in the city of Wuhan, I believe that's how it's pronounced, in China. 40 cases and 2 deaths. There's a few additional cases in Thailand and Japan, which are believed to be related strictly to travelers that visited the city of Wuhan, China. The one case in Washington State is also believed to be associated with somebody who traveled to that area. And the cases in the city itself are supposedly tied to some kind of large market that sells seafood and other animals. And coronavirus is very much like pneumonia, the symptoms. People who are reasonably healthy, certainly, even if they suffer it, they can recover from it with care. The concern is for elderly folks and for the immunocompromised who don't have access to care. And right now, there's no reason to believe that there's going to be an outbreak of it in the United States. But the CDC at the federal level, the state health department here, and local health folks like myself are paying close attention to it because a decade or so ago, we had SARS, if you remember, severe acute respiratory disease that made its way to Toronto and became a real scare for us here. So we don't take these things lightly, and we're keeping up with the data. But there's no recommendation at the local level right now, being that there's only one case and it's in Washington State.
Right.
But we're monitoring it just like the CDC has asked all health departments to do. And I can certainly forward any updates to the board as necessary.
Yes, that would be helpful.
Yeah.
Thank you.
Of course. And I just also wanted to mention that the DCA, the State Department of Community Affairs, we're told is going to have as much as $5 million available to support lead abatement, homes that have high levels of lead, especially those that also are accompanied by cases of childhood lead poisoning. And there's reason to believe that the DCA is going to work with the State Health Department to have the State Association of County and City Health Officials, the State Health Officers Association, administer a good portion of that grant. So we've done this, we being the state health officers, we've administered a lot of significant grants, and the first objective will probably be to hire somebody on a contractual part-time basis to oversee this. But we've had significant lead funding in the last 2 years to do case management for lead cases, and most of that's gone to the big cities and the county departments that have the sheer numbers. But this is the first time that we're looking at probable, if not almost definite, grant funding for actual abatement, where money could go directly to homeowners in a sense that need some assistance in abating conditions, in mitigating problems that are harmful to kids. So that's another thing that we'll have to get updates on as it develops. And that's about all I had to share.
And the report that you gave us about the...
I'm sorry, Councilman.
I got a question about the report you just gave us from the activity that is done over here. the influenza vaccination, and you say we got 15 cases over here, so is there any way that we can increase the amount of, this activity in here? Because I know you do it in Rockaway. I know, like, blood screening, doctor screening. all that.
Also, digital clinics?
Yeah.
Oh, yeah.
Because I have a resident telling me about it and asking me, we tell them, okay, you gotta go to Rockaway. Most of the people over here, they just hardly wanna go out of town to get into, I don't know if it would be possible to get some of those activity over here.
Yeah.
In the year, instead of going all the way to Rockaway.
Yes,
And it, to benefit actually the residents of this town.
yeah, and thank you for that, because it's something that I was actually speaking with our new nurses about, because a blood chemistry screening, we just talked recently about trying to do twice a year here. People that want to get their Chem 23 or, the screening for cholesterol and those other blood levels, we can easily do that here, and the spring would be a good time to do the first.
Whatever the time you guys decide, it would be a good time to do it, but provided that it's over here, and that way we can pass that along to our residents.
Absolutely.
That would help.
Yeah, promote as well. Yeah, we're actually, I don't know if I mentioned it, but, we're working on a small calendar of events, some of which would be available in Rockaway because they just require certain facilities, and some which we would do directly here.
Mhm.
So we'll have a calendar in the next month probably for the board to review.
Okay.
So including extra clinics and screenings here on site.
Right.
Yeah, thank you.
Yeah. Good.
Thank you, Councilman. Thank you, Peter. Any other questions? And my other question to you, as far as it goes, with the flu, there's two types of flu out. There's what are the types? Type A and B?
Yeah, there's novel type A influenza, which is not seasonal influenza.
Mm-hmm.
It can happen any time of year. The H1N1 pandemic we had about a decade ago in 2009, that was type A influenza, so that's unanticipated, which means there's usually not a vaccine prepared to handle it, and it has to be developed quickly. But the more common flu we see is the type B seasonal influenza. I'm not a virologist and I don't pretend to be one, but the type B we see all the time. It doesn't require something that's called an antigenic shift. Type A requires, usually there's like swine involved, and/or avian species, and when they mix the flu virus and they change the protein envelope on the actual flu virus, we get the type A influenza. And that type A influenza either is going to only be transmitted from animals like the avian species to humans, and in rare circumstances it becomes transmissible between humans, and that's when we have huge concerns. And that's what happened with H1N1. So there are several specific types of A viruses that are present in the world, none that are knocking on our door and that are providing us with a big scare at the moment. But when manufacturers make the flu virus, we now commonly use the quadrivalent vaccine, which it's used to be trivalent, which was set up to immunize, determined by experts around the world, especially the CDC. They usually get it right, but some years they clearly have not gotten it right. And there's been a subtype or strain of flu that's just not been covered by the vaccine very well. But now we use a quadrivalent, so it's designed to protect people against 4 different subtypes of flu. And that's drawn from international data and experts and what we see coming. Many of our flu strains come from other countries, don't necessarily generate here.
Right.
So there's a lot of experts that are world smarter than I could ever dream of being that contribute to those discussions. So yeah, type A and type B, less likely to see type A.
Okay. And our flu shot covers which one, A or the B?
Both in this case. The last few years, one of the 4 subtypes of flu it tries to control is H1N1, and that goes back to 2009. But there's a couple of different type A viruses that are covered in the new quadrivalent vaccine. I want to say one of the other ones is A3N2, but I'm not really sure, and I'm not sure how much it matters in the moment, but I'm pretty sure that at least 2 of the 4 subtypes that are covered in the vaccine are type A flu. H1N1, without question, that's been in the quad for several years.
Okay. Thank you.
Yeah.
Anyone else, any other questions? No. I'd like a motion to open the meeting to the public.
Motion, meeting to the public.
Second.
All in favor?
Didn't you forget something on the agenda about the animal control or animal hospital?
Oh, yes, we did.
You wanna go back?
Yeah. Go back into the regular order of business then. Update on animal hospital services.
So we're looking to you, Peter, for that.
Oh, okay. I wasn't sure what,
I had mentioned that to Jane, we told her to tell you that.
yeah, so Deb and I have had some discussions about the borough's desire to find some sheltering services.
Mhm.
I've been having discussions recently with the HODAS Veterinary Group, which serves Rockaway Township, for sheltering services, and they're not at all opposed to it. I got some numbers from Deb recently to provide to the group. I've been playing phone tag with a gentleman named Bruce who is one of the principals at the facility, and it's just a matter of confirming. I mean, the demand appears to be so slight that it shouldn't be an issue. And if for some reason that particular veterinary group decides that they're not capable or willing to do it, and again, every indication is that they will, then I have two other shelters that I'm prepared to call the minute that we find out that there may not be the original option.
Can you divulge that?
Yeah, they're municipal or regional shelters
Oh.
in Morris County.
Oh, okay.
I'm reluctant to give specific
Okay,
names,
that's
but they handle sheltering for a number of communities, so they would be
Good.
well prepared to serve. And they're pretty local. I can tell you, one is Jefferson and one is Randolph Regional. So I'm not, there's no reason, I'm not like, I'm transparent, it's not.
Okay.
But I haven't really negotiated
I'm
or
not
discussed
familiar
with
with
them what they might be considering in terms of fees and things, so I don't wanna jump the gun.
Okay.
And I have relationships with, we serve Jefferson Township for some health services, and I've had a relationship with them for 30 years, since I got in the field. And Randolph was my first place of work, and I still know some of the personnel there, so they would be willing to consider if we need to, that should be an issue.
Thank you, Peter. Okay, now I'll make a motion to
That's what the fees are.
Motion open.
open the meeting to the public.
It's a motion to.
Motion?
Yeah. Yeah.
Second, all in favor?
Jim Janelle, 15 Franklin Road. One thing I didn't hear mention of was what is the projected fees gonna be with HODAS if they decide to take it on?
That's, well, we're first going to figure out if they're going to actually take the service. I have a fee schedule from them, I don't have it with me.
Because I mean, that would be the same fees basically that Rockaway is paying?
Yes, and it would be à la carte, so to speak.
Right.
There wouldn't be an annual charge of X amounts of thousands of dollars, it would be per animal, per evening, per service.
So what
Okay.
we pay is the same price.
Is that something that Debbie's already gotten a copy of all that info?
I'm not sure that Deb has a copy of the fee schedule, again, because we don't have confirmation from the veterinary group yet.
Okay. All right. And while I have it here, in regards to, I guess, the information about announcements and emergency kind of stuff, how do you guys get it out to the residents of Rockaway? I'm just curious, other than a calendar, is there like any other?
The township website is one reliable source. We have an email listserv through community services that residents can sign up for. If it was necessary, we would do it through Nixle,
Right,
through
okay.
people's cell phones. And if necessary, we would also ask our Rockaway Police Department to do it through reverse 911. It depends on the severity of the emergency. The last time we actually employed any of those more significant services like reverse 911 or Nixle probably was during the last significant hurricane during Irene and Sandy. When we had a couple of weeks without power, and the American Red Cross, we were serving meals to people just because we needed to get those messages out because we had thousands of people without power.
Okay, well, maybe this is something the Borough Council, as not only the health department, but as council, why don't you guys look into the Nixle alert system, because I signed up for it, I think it's with the county, and I get all the county alerts.
Anybody can. All
I
you
know
have to
that,
do
but I
is-
mean, we don't have anything here specifically for our town. I mean, other towns are signed up and they do their own thing. And I think maybe you might wanna, cause I mean, you gave a lot of information tonight. How come we can't have that on the website? Like even on the main page, or have a separate page just for health department related, like things that we should be aware of? Maybe, you know, anything that pops up, like this new, virus that's running, well, almost here, but not quite.
It's not coming.
I mean, those kind of things that people maybe need to be aware of. You know, can we get that put on the website? I mean, the webpage is basically very blanket, bland. You look at other towns, you see all kinds of alerts, announcements for Board of Health, Recreation, I mean, you name it, they got it on there. So maybe we can kind of freshen ours up a little bit? Or is that something you gotta talk to the full council about?
No. No, I told you.
I think it would
Does
be
you-
charged on that.
do we-
Well, there's a charge for everything, but I mean,
Do we-
once it's established, it's a matter of just updating it, that's
Or
all.
what?
That had to be,
But I mean, like, when you announce the flu shot,
Okay.
maybe people don't get the flyer,
right.
Mhm.
and you might get a better turnout if it's something on a public bulletin board like that.
We don't get a turnout for anything here, Jim, you know.
Yeah, but I know that, but the flyers don't kinda help, because you go to the apartments, it goes in the laundry room, and if you don't go do your laundry, you'll never know about something.
Well, the apartments, that's private property, we have no
I know
say on
that,
that.
I know that, but
We
same
have
with the
no
condos,
say.
you put it on what, the bulletin board, Debbie? And you're supposed to hope that the residents go read the bulletin board, there's probably a lot of them don't.
Yeah, because like, in the last X amount of years, I think the most we ever had down here for the flu shot, including people that even come to our council meetings,
Yeah,
with 20 people, probably the tops.
well,
But this year was 15.
well, maybe this is something that needs to be on the website, a little bit more than a calendar.
Well, I think
Yes.
the flu shots were on the website,
Yeah.
and the newsletter was sent around. You can't make people come.
People come,
you
that's
know.
right, yeah. Like, we have numerous things down here. Before we had, the awareness of opioids, what we get? Well, how many people? We have 12 people here? Some people didn't say, they never knew it, and we sent flyers around. Nah. We can put on, we can, like you said, we can and we'll put up things up on the
Well, I mean, the
website.
information is like you got tonight, that I wasn't even aware of. Maybe the residents, if they read about it, they would keep a better, you know, eye on things and educate themselves. That's
Everything
what I'm
will,
asking about.
everything will help, regardless what it is.
Yeah, all the information, I mean, information is very valuable. It's what you do with it. And I know you were talking about the vaccination thing. I know when I went to school, elementary school, everybody had to go get vaccinated. I don't know why it's such a big deal today.
It's, well, you know, it's become much more a political or socio-political issue.
No,
now.
probably,
The pure-
yeah.
Pure science of vaccine, yeah.
But I mean, kids are the biggest carrier of everything.
What is that, Peter? That political and religious?
Well, yeah.
Well, religion
Yeah,
was
and-
back then too.
I know, we know.
Well, you didn't hear about it a lot.
Well, like you said before too,
Everybody.
you didn't get vaccinated, you didn't go to school,
Right,
period,
exactly.
period. No effort into
Right.
class.
That's the way it was back then.
Yeah,
But now it seems like we're just going crazy.
Well, I can't speak for people's different, everyone's obviously entitled to their beliefs and their
Mhm.
opinions, but the same things still apply in the written law, that if you don't get vaccinated, then you're homeschooled. The way the law is currently written is, and our nurses go out and do immunization audits of every child care center in every school for the 12th grade. Children that don't have the current vaccinations are not permitted to school. We can write summonses against those schools. Usually the school superintendents and the administrators and principals work with us to the point where we can get it taken care of, and we actually provide free vaccinations to kids from Victory Gardens, Rockaway, to make sure that they're up to date on them.
Yeah.
But if they're not up to date or the parents disagree, then the law says they can't go to school. It's just a lot more people are outspoken, I think, about it these days than 30, 40, 50 years ago when I got my vaccines.
Yeah, I mean, I didn't worry about it. I figured, when I was just a kid, I didn't care that, I had to do it,
Yeah. And not only that, we're one of the few towns in the area that they give out free flu shots.
Well, maybe you need to get the word out a little bit better.
It's been out there, Jim, it's been out there a long time. People just don't want it. The guys I work with, out of about 8 guys, I'm the only one that gets a flu shot. Why? Because nobody else believes in it.
If I
Nobody wants.
Well, I just got a flu shot again because they said it's it was new stuff. The stuff I got last year was like not good. The new stuff this year was the updated
Well,
one.
plus the flu shot's only designed to provide the immunity for 5
Right.
to 6 months, so we always preach annual flu shots is essential. But just to put this in perspective, 15, 20 people come for a flu shot here, a town of roughly 1,400 people, 1,500 people. When we provide flu clinics to the town of Foodton,
Mhm.
which has 8,500 people plus minus, we get 40 people max. So comparatively, Victory Gardens is right in line with
Right.
Rockaway Township, which is
Mhm.
several hundred, but we have 25,000 people.
Mhm.
So proportionally, 15, 20 people is not a lot, but it's probably right in line with what
Right.
we're providing in
Yeah.
our other towns.
Yeah, and speaking about that too, the one that I told one of the residents, because one of the residents wanted to know this, I said, we always advertise stuff. I said, look, here's the fact. We hand out flyers for the flu shot. We get, let's say, 20 people. We hand out flyers for dog and cats, the rabies shots. We get 80 people. What's that saying?
They care about the dog.
The dog-
There you go.
That's
There
the
you
dog
go.
owners care.
All right. Yeah, right.
And we did a rabies,
Yeah.
I didn't mention, it, but we did a rabies clinic in November here.
Yeah. And we get a bigger turnout for rabies shots
You're absolutely
than for
right.
human shots. And we advertise the same way.
Hey, I don't know what the answer is, but you gotta come up with a solution on that.
But we can't drag people down,
No. And
Well,
by
and
the way,
that'll never happen.
and they do have flu shots for dogs now, because my dog's taken care of.
I saw a lot of people gets it in their own workplace. In my place, they give you flu shot free. So everybody.
Well, maybe people don't wanna come here, they wanna go to CVS.
Yeah, right. But like I said, nobody, I'm the only one, the only one. I'd like a motion to close the meeting to the public. All in favor? And with that, I'd like a motion to adjourn the meeting.
Motion adjourned meeting.
All in favor? Right. But yeah, like I said, nobody at my job believes in a flu shot.
And our dog's flu shot is
Hey,
2 shots.
these aren't, this is the new generation.
New generation, the government is trying to kill them.